what you're doing and where you're going, and I'll try to figure out my setup.
Okay, sounds great. So like Dr. Sevilla said, I'm Kelly Thibert, and I'm a recent graduate of Grant Family Medicine Residency in Columbus, Ohio. So that was just 2 weeks ago that I graduated, and then almost a week ago now, I took boards. So boards are typically in April for family medicine, but due to COVID-19, they were pushed back. So a lot of different folks are taking boards sometime between July and August, and so mine were last Thursday. The day after my boards, I flew down to Florida, very appropriately socially distanced as well as you can on a plane. The airline did a great job. And I flew down to Florida because Florida is where I'm from originally. I was born and raised here. And I say here because I'm still in Florida right now. I'm at my Airbnb. That's where I'm coming to you live from. So I flew down here because I'm looking for a house. And this is where I'm going to be practicing full spectrum family medicine at an outpatient office. I think I'll be able to have the opportunity to also work inpatient with some residents on a family medicine inpatient service, which will be great. I'll still be able to do procedures that I learned in residency, caring for everybody from newborns to geriatric patients, also being able to do house calls still, which I'm very excited for. And then, of course, still being involved with the AAFP and now my new academy, the FAFP. So lots of things going on. Happy to be done with boards. Just kind of waiting to hear back how that actually went, and fingers crossed on that front.
I can hear you now. I'm so excited. Man. So just to let people know before the show, as I was logging in like 10 minutes before, my whole computer crashed. So I think this is the residual from that. So I heard part of that, Kelly. So it's very exciting for you. So are you from Florida originally, or?
I am. Yeah, I'm from South Florida, but I'll be moving to the West Coast, so just south of Tampa in an area called Bradenton.
Okay.
So practicing. Yeah. So.
Okay.
It's very humid here.
So did you go to med school in Florida?
I did. I went to Nova Southeastern University College of Osteopathic Medicine, and that is in Fort Lauderdale, Florida, which is where I was born and raised. After that, I went to an undergrad school in Orlando, moved back to go to med school, and then did some health policy stuff before residency, which ended me in Columbus.
Well, yeah, but during that time, you were like president of the American Medical, or the American, was it the American Medical Student Association?
Yeah, AMSA, the American Medical Student.
You were AMSA? That's like awesome. So I think I met you right around that time, or paths crossed, or I saw you speak or something like that. So so how did you find your way to Columbus? Because usually people in Florida, they're snobbish. They're like, I'm never leaving Florida. Like, come on, why would I ever go north for anything?
Yes. And coming to Columbus was very weird because everybody asked me that question, why I was coming there, because it seems like everybody wants to go to Florida because it's beautiful. Well, the weather's beautiful when it's not so humid. But when I was looking for residency programs, actually, I had made my list already. I had interviewed at places. I was kind of on the trail, and I was still looking around at different programs while I was traveling. And I came across some friends on Facebook who were at this program called Grant Family Medicine, and they were some really great friends. So one of them was Dr. Colin McClooney. He's one of the attendings over at Grant, but he actually used to be the Education and Advocacy Fellow of AMSA. So I knew who he was through health policy work there. And then another one was the, at that time, Chief Resident, Matthew Adkins, also now an attending over at Grant. He used to be a national leader in AMSA as well. So I was wondering why these really fabulous folks were in Columbus, Ohio, of all places, because I knew they weren't from there. So I reached out, asked them, what was going on, what the program was like. And luckily, they accepted me for an interview. And I knew the moment after I walked out of the door that my rank list had drastically changed, and they became my number one program to match. And so I ended up there, and it was such a fabulous experience. It's been pretty bittersweet graduating and having to say goodbye to everybody, because they really are a great family.
Oh yeah. I mean, it's been nice getting to know you since you've been here in Ohio, and obviously that will continue. So, Something I've been talking with residents and students, about the last few months, about their curriculum and about learning and what kind of happened. What were you doing education wise, in February and March, and how were you informed of what the curriculum changing and what was that all process like?
So it was quite a whirlwind. I think that our program did a fabulous job of adapting as everything changed. I will say hour by hour, quite honestly. I'll start with the very first thing that was a major change, as was with many programs, was that our didactics became virtual, and they did a really fantastic job, and we're actually even able to add in more learning opportunities to not just our weekly didactics, but to other lunch sessions that previously were not in existence. So that was really wonderful. In terms of where I was at, so I was just coming off of an inpatient service. I was doing mostly outpatient for the rest of my time at Grant. And so with that, though, a lot of it was ambulatory rotations where I would be with specialists. And the specialists, of course, stopped taking learners. And so that was pretty challenging because those are things that they're really great experiences to get to go be with a cardiologist or a dermatologist and, see the things that family medicine doctors refer there, or things that maybe should have been referred sooner. It really helps you to have that understanding as a family medicine physician, when to refer, what to refer, and then really just how to manage certain things on your own. And maybe some people don't feel comfortable with. So, we did miss out on some of those things, but we had folks, attendings who were tracking the curriculum that we did miss on those rotations so that we could get some other opportunities to make up for that. Unfortunately, one of the things that I missed was an away rotation, which was kind of bittersweet as well. I was coming down to Florida to do some rotation work here. And, traveling was not recommended during COVID. Still is not recommended unless you really need to go and travel somewhere. So, a lot of things were changed. And then with all of that, we saw patients in the office in quite a different way, just like everybody else in medicine is doing. So we really had to jump in and learn telehealth, both phone visits and then video visits. We started with just phone visits. Which are very different than video visits, especially when you have somebody who's not tech savvy like myself trying to work the video with a patient who's also not tech savvy. But we got a lot of really good training around that. We had one of our residents, Kelsey Murray, who was also an OAFP leader. She was kind of our IT guru at Grant, and she was able to help us learn how to do certain things within telehealth and with coding and with documentation that really sped things up and got us up to speed. So,
what was your experience with telehealth? Pre-COVID, any experience at all? Very limited. I was just kind of curious, just from a resident perspective.
Yeah, so we didn't have telehealth worked into our visits. The type of telehealth that we would do is, we're required to call our patients back with their results. And so when we call them back, sometimes those results that we get back mean that we need to make changes to a medication regimen, or we need to add something or discuss something. And so that is kind of like a mini visit, and that's what we were doing prior to this. But now, the entire visit is telehealth. And so we really had to talk about, like, how do we then come up with ways to do a physical exam or to get vitals, and the types of things that we should be doing in addition to maybe when you're just clearing your electronic medical record in basket and making those phone calls back about labs. So it was quite different than what we had before. I don't think it was that hard to pick up on, and I think that's because of the great support that we had from our attendings and my co-residents who made it an easier process of something that was, for the whole country and for the world, chaotic day to day.
Now, anybody who, graduated in 2020 kind of feel like gypped, kind of ripped off, because the lack of in-person, that type of thing. So how did your class kind of deal with that? I mean, I know it was really difficult to find closure, or like, how were those last few months communicating with your class and getting ready for graduation, and can you describe a little bit of it? I mean, I would imagine it was virtual or not in person and that type of thing.
Yeah, we actually had mixed mode graduation. It was pretty innovative. So, historically we do everything in person for graduation. Our class, the class that I graduated with, One of the things that we're most known for is having a monthly potluck since intern year. We've maybe missed 2 throughout our 3 years together in residency. So those were something that kind of went away because we couldn't meet in person. And our schedules were just all over the place with when people were getting pulled to cover for patient care. So that was more challenging. And I think, not being able to be not only just with your class, but with the staff and the faculty and seeing them and those relationships that you've created over 3 years. And then on top of that, your patients. You're getting ready to leave and you don't even get to see them in person. You don't get to, hug them goodbye or shake their hand. I had so many patients who were upset when I told them, I was moving back to Florida and wanted to give me a hug. And it was hard to say, I can't, we need to socially distance, because you honestly, you feel that same respect for your patients as well. And you've made that connection. So that was really challenging. And I think, left me wanting a little bit more during COVID. I think our program did such a fantastic job at celebrating our graduation and really making us feel special. So we had almost several hours of events just for graduation. We had a small in-person little session where the graduating third years, we got to meet all of the incoming interns, which isn't typical that you get to meet them as they're integrated into the program because they're kind of off doing orientation somewhere else where you don't see them. And so we got to spend time with them and just talk to them about our experiences and how excited we are for them and what's coming up and just why we love family medicine so much and why we're so excited that they chose it. We got to share, amongst our class with our program director, Dr. Herzog, and with one of our associate program directors, Dr. McClooney. We got to share a lot about, reflections of our 3 years, which doesn't typically happen with graduation. The residents don't do a lot of the talking. Typically, faculty does at most graduations. So it was nice to be able to just have this more intimate setting of a graduation, which was pretty much, more so like our class, to be honest. And then in our office, we have 4 different, we have pod-based care. So we have 4 different pods in our office, and each of our pods decorated in different themes. And then we did a clap out. So they led us all through the office in different ways, and we got to see how they decorated, and everybody was cheering and clapping, and it was
nice.
It was really just wonderful. And then of course we went online later to do all of the actual like ceremonial type of things that our families could see. But sure. Yeah, it was really great. It was special. I think that's a really hard thing to make special, for anybody right now. It's hard to make any occasion special. So even just the fact that they showed up and really put so much thought and effort into it meant so much.
So as we sit here, it is the middle of July, and we got through the first holiday, July 4th. And are you able to share a little bit about what specifically kind of your class, shared with the interns, or specifically, what advice do you have for, those students now, first year residents starting out, their next stage of their education in this age of coronavirus and COVID and the pandemic? What advice did you pass on to these new doctors?
Yeah, one of the things that we mentioned was find your why, which is a huge thing. And if you've been a part of the AAFP, you've likely heard it before, but finding your why, not only in medicine, but specifically in family medicine. Because while this is such a fabulous specialty, the best specialty in my opinion, I'm a little biased, even though it is such a fabulous specialty, you will have hard days, you will work long hours, you will get stressed. And in those times, you really need to think back to what your why is and why you're here in family medicine specifically. And so we kind of recommended, doing that in some way in which they can remember. I had written an email to myself before starting residency so that I could go back and read it later. Some people keep their personal statements to refer back to, and I think those are good ways to do that. Something else that came up, which I really recommend, is finding not only your why, but your wellness. Turning inward to find out what is it that makes you well. And of course, going to work and seeing patients and being part of, a larger team is something that does make most of us, it makes us feel very good. But like I said, there will be hard times, and you need to make sure you take time away from work and time away from your co-residents and just do what makes you happy, and something that makes you feel complete. And whether that's, working out or reading non-medicine books or painting or doing yoga, joining the OAFP or AAFP, things like that. Just finding the things that make you feel well and making sure you make time for those things. That's challenging to do, especially as a resident, especially as an intern, and especially during COVID. But our recommendation was that if you think about it earlier rather than when it's too late, hopefully they'll have built in some time to make the time for wellness for themselves.
That's awesome. That's awesome. My guest is Dr. Kelly Thibert, and one of her many titles, other than being awesome, is being a member of the AAFP Board of Directors as a resident, and that'd be a great experience for you. Can you share a little bit about your year that is coming up to a close very, very quickly?
Yes.
What have you learned? How was your experience? How would you describe it?
This has been one of the most rewarding experiences that I've been afforded the opportunity to have. Quite frankly, I was very nervous when I ran for the AAFP Board of Directors because I didn't know as much about the AAFP that I thought one should know. And I want to just stress that to be in any leadership position does not mean that you need to 100% know the things, right? So these are learning opportunities, especially as students and residents. And so throughout this year, I've gotten to learn so much from the board that I served with, and then also from just everybody else within the academy, from the staff to the other members and to the other leaders. Some things that were really great were learning how to speak up in a setting in which you are likely not the most well-versed person because you have the least experience, and being okay with that, and being okay with going out on the ledge and sticking your neck out there to maybe say something that won't be favorable to other people, but it's your opinion, and as long as you share it in a professional manner, learning how to walk that line. The AAFP board is so phenomenal at teaching and allowing students and residents to have that space and to have difficult conversations without any, retaliation or without looking down on anybody. They know that we're here to learn and that our aspects and our points of view are very important to the academy and to family medicine. So before the board of directors position, I did serve in some other positions. And, I remember before each position that I ran for, I had these nerves, would I be good enough for this? We all have this imposter syndrome when we run for things, right? And it's the same with medicine. Will I be good enough? Should I do this? Somebody else should probably step up and do this. I don't know why I should be there. And so that wasn't even just with the board of directors. It was with every position. And I just want to let people know that that's normal to have. And I just want to encourage you to push past that a little bit, because you should be there. You should be in the room. You should share your opinions and your points of view, because they're very valid and they're very valuable to not only whichever community you're serving, but to the larger community, to family medicine and to your patients. So it's really important, if you want to be involved and to just step out there and just know, especially within family medicine and within the OAFP and within the AAFP, you'll be supported as a student and a resident leader.
Yeah, we're going to talk about this a lot. But we can just go ahead and transition to our next topic, which is the AAFP National Conference of Family Medicine Residents and Medical Students, which is coming up at the end of this month, and it shows a special place for me, and I'll share about that in a little bit. But you've been to the meeting for many years. It's a leadership meeting. It's part leadership meeting. It's part education. You learn so much when you're a resident and a student. Can you remember, your first national conference or your first couple national conferences, and especially kind of frame your answer now as far as, if there's a student or a resident out there who has never been to a national conference, how would you describe what it's like or what your first experience is like?
Yeah. So I will say, take this with a grain of salt, because this year's national conference will be a little different because it's going to be virtual, but still just as fabulous. But my very first national conference, so the very first one I went to was actually when I was the national AMSA president. So I was there kind of like on business to get to know the AAFP and to partner with the AAFP. So I didn't do a lot more than the Congress of Delegates, honestly, which is what I was there for, which is really fabulous, which we'll talk about in a minute. The year that I went, though, as a learner to see the entire conference, the very first thought I had about it was overwhelmed. And I hear that from so many people as well, because there is so much going on. There's so much to choose from. There are so many people, so many residency programs to talk to, and you just get overwhelmed with, how do I even organize all of this? How do I get to do it all? And am I going to get to do it all? And you kind of get that, FOMO, the fear of missing out. You kind of get that a little bit. And you feel like if you miss certain booths or certain presentations, that you didn't get the full feeling of national conference. But I will say, even if you don't get to go to every little thing, which you won't get to go to because it's just how time works, you're still going to be able to have an incredible experience and learn so much. You can supplement whatever it is that you want to learn more about. Or if there's something that you've never heard of and maybe you're just interested in hearing about it, you can do those things. You'll be able to talk to folks from residency programs, so you can start feeling that out and see where you want to apply, or where you want to rank programs, things like that. And then one of the things that I really nerd out about is Congress of Delegates, which is where policy happens within the academy, both within the student resident Congress and then also the larger Congress of Delegates, which is held in a few months for the whole academy. So there's a lot of different things to do there. And I think overwhelmed is the first thing. And then on the very last day of my first national conference, it was just pure joy. Because I knew I was in the right place. They were my people. And I think, especially as a resident, let me speak to that, coming from medical school to residency, and you try to find who your people are. And hopefully your program is your people. But, there's that group of people. So when I was a med student, AMSA was my people. And then you move on and you're trying to find them again. But the AAFP is your people. You're going to find your people there. And that's what brought that joy to me, was that I finally felt home and I felt like I found my folks.
Yeah, AAFP National Conference is July 30th to August 1st. Yes, it is virtual, like every other conference is these days. You can get more information at aafp.org/NC. And yeah, we will get to the conference and policy things. I just wanted to highlight just a few things on the schedule. The main stage sessions, there's going to be some cool main stage sessions. There's going to be a main stage session about the virtual match environment, which is going to be, I think it's on Thursday.
I think it's on Thursday, yeah.
And then there's going to be a main stage about the broad scope of family medicine now and in the future. I believe it's on Friday. And those will be great, but I think the best one will be on Saturday.
Who's on Saturday?
Non-biased, I will be there on that session. Yes. And we're going to be talking about, the storytelling, family medicine storytelling. We have a great panel of people that's going to be sharing their stories, family medicine wise. And that's really kind of the heart of family medicine. I'm really looking forward to it. We've kind of had some of our, kind of sessions trying to figure out what we're gonna do, what we're gonna say. So that's going to be fun. And then, the virtual expo hall. So that's going to be cool. There's going to be other sessions other than the main stage sessions that are going to be at the conference. And then, so let's kind of dive into, the policymaking, which is, what we love. but when you first go there, when I first went there, I think it was like a second year medical school. I'm like, come on, just let me do like the joint injection workshops and, that type of stuff, and then you keep going back and you're like, well, what are those people doing in that other conference room over there? They seem really energized. They seem really excited. Like, what's going on? And you go in there and you're like, oh, what policy? I'm like, really, policy? Come on. But then you get in there and then you talk to people, and you see how you can really influence, health policy or policy, not only nationally, but also at a local level. And that's really where people can really make change. And that's why I started getting into it. And, I was very chicken about running for stuff, Kelly, I have to tell you.
Were you really?
Yes, yeah, for every year since I first went, like my second year of medical school, they're like, Mike, you got to run. Like, you're awesome, you should run. I'm like, no, look at those people over there. I cannot compete with those people. They're like awesome people. I know those people. They're fun people. I can't run against those people. So, kind of as a dare, my last year of natural comedies as a third-year resident, I'm like, okay, you people can just shut up. I'm going to run. I'm going to write up a speech. It took me like 3 minutes to do. I get up there. I do the speech. I'm like, okay, let's go and have an adult beverage somewhere because I'm going to lose. So we're all going to have fun. I can go on with my life. I can find my job. And then I won. Resident delegate as a third year. And I'm like, what am I doing here? I don't belong here. Imposter syndrome, like you're saying. But that's really where it kind of took off for me, and it took me all that time. And people will talk to me now. Oh, Mike, you've probably been running since you were like in high school for elections and things. No, it doesn't, because everybody has their own time. Everybody has their own, when they feel it or they don't feel it, or they have this group of people around them who you're friends who are encouraging you or pushing you, and that's when it happens to everybody. So. So it's fun. It's fun. Everybody kind of finds their own way, whether it's, with clinical topics or leadership topics or whatever. I have a lot to say about that conference, and it holds a close place to my heart. And I will be, going back there as much as I can, even if it's just to hang out. Even if it's just to hang out now with people, my peers who we're like the old people now. Like, you remember back in the 90s before cell phones and before the iPhone, we were doing really stupid stuff that nobody knows about now. So we're glad that there's no video evidence of anything now.
Incredible.
Yes, and then you have these friends for life, and then, they're people doing great things in different places in the world. It's not just in this country, and you're like, oh, I remember when, we were in Kansas City at National Conference doing whatever. So that's my little National Conference story.
That's wonderful.
So let's talk about leadership positions. Every year we talk about leadership positions, and I really appreciate you sharing your story about being on the board and things. Feedback that I get, from residents and students, and I know you probably get the same feedback too, was that what really kind of a voice does a resident or a student or a new physician or a new to practice physician have in the academy? It really can't be that much, because you have all these other people who have been experienced for years doing leadership. What do I have to say as a resident or student? How do you respond to that type of question?
I get that question a lot too. Yeah. I will say, just like I said before, is that the student and resident voice, especially, my experience on the board, is very much appreciated and heard. And, in fact, at the beginning of COVID-19, myself and my student counterpart on the board, we had been hearing from a lot of students and residents around the country who were potentially being put into unsafe situations. And this was under the guise of learning. And there were a lot of things that we just had concerns about. For safety, for students and residents who are already in challenging situations, and then putting programs in challenging situations being down, residents, especially if they become sick. So Margaret and I, we brought this up and spoke to the board about it. And it was a pretty lengthy discussion. From that, there was a policy developed on learner safety during a pandemic. And so if that's not evidence of like how much the student and resident voice carries, especially at the board level, then I don't know what else would be. But, from that instance of bringing those concerns to the board and really seeing that product come out of it was in such a timely manner was really impressive and really confirmed, what I had been thinking the whole time I've been on the board, which is that they really do listen to what we have to say, and they are interested. They know that we are the current family medicine doctors and we're the future family medicine doctors, and we have the input that they need and that we all need to really make our specialty even better than what it already is. And then aside from that, there are instances in which at the national conference, we usually have, the Student Resident Congress where you can have your voice heard as well. I don't know if now's a good time to bring it up, but you kind of mentioned it before. Okay.
Go for it.
So you kind of mentioned it before. So during the Student Resident Congress, when we have them in person, these events, this is where people will be voting on leadership positions and where people will be elected. This is where reports from past leaders are heard, things like that. But the most important, in my opinion, and not that voting for leadership and running for that is not important, but the most important are the resolutions that are brought to the Congress of Delegates. And so we could have a whole nother talk on what is a resolution and how to write it and what happens to it. So if anybody wants to do those things, please let me know, because I love resolutions in the Congress of Delegates. But yeah, this is where students and residents, they write things, resolutions that they want to see policy changed or addressed, things like that, to be submitted to the Academy. So typically those things are submitted to the Student Resident Congress. They're debated upon in the Congresses, and then hopefully they come to a consensus, or they don't. And then these issues kind of get brought up the chain at the AAFP so that people who are in the decision-making capacity to hear from the students and residents hear these things. This year it's a little different because it's virtual. So we won't be writing resolutions, which I'm super bummed about because it's always a great learning opportunity. But there will be a way to get your voice heard. So with that, right now we have, I think they're open already, and if not, they're sending an email soon for students and residents, delegates, to participate in forum discussions on the AAFP website. And in these forum discussions, as it relates to the national conference forum there, on these forums, students and residents can put down anything on there that they're concerned about, that they think the AAFP is not addressing, or maybe not addressing in an appropriate way, or whatever it is that they want to write. They can write these things there, and people can discuss about them, their thoughts, their points of views, what they think should be done, what should be changed, why is it great. And so from there, hopefully people will read through those before coming to the live the virtual national conference. And there we'll have some live sessions, about 30 minutes, where people can kind of convene and talk about these particular topics in a chat room. And so you'll have some board members there to help facilitate. Some staff members will be there to help provide, historical reference within the academy, which is really great. And then, our hope is that from that we can synthesize kind of the overall feeling from the conversation, just kind of like how a reference committee would typically be done. They kind of synthesize what the overall feeling is. So hopefully they can take that and then divvy them up to different commissions to review what the students and residents are really talking about and want to address. So it'll be different, but still being heard.
So Kelly, you have a fan in our chat room, and it's our friend Judge Julie Wood. And I think Caitlin will try to put up a comment for Facebook if we can. So she says, as you can see, there's an excellent board member, has been on the Commission on Health of the Public, ask about her new skills and how do you evaluate guidelines. Hey, that's something I need to know about.
Oh my gosh.
What can you teach me about that?
Thank you, Dr. Wood. I think Dr. Wood's the better teacher. I'm so happy that she said that. This is one of the most incredible things I've been able to participate in, being a liaison to the Commission on Health of the Public and Science this year. And so, we get an agenda a week or two before each of our meetings, and they're typically several hundred pages long that we read through. This last one that we had was very interesting because in it there was information about how the Academy evaluates guidelines that are proposed by other organizations. And it was a sample guideline that we were reading through. To be able to kind of get our training done. And so there is just so much that goes into whether or not the Academy recommends or does not recommend or supports guidelines that are being put forth by other organizations. I had no idea when I was in all of residency. So this just happened a few months ago, and this is when I learned about it. I had no idea how the AAFP came up with how they would determine whether or not to support a guideline. But there's so much that goes into it, even, as minutia things of, is this actually a good study? What things are they missing from this study? And it's really using a lot of that information that you should have learned in med school and are probably still learning in residency about what makes a good study and how to utilize those things. And so they teach you that and how to integrate that into looking at these different guidelines. I was so impressed. They do so much work. You always see the different articles come out that are like, the AAFP endorses this. And you're like, okay, great. I'm using this in my patient encounter, moving on. We never take more than a few seconds to really think about how that gets there to be endorsed that we're just using. There's a lot of science behind it, honestly.
Yeah, and you're talking about other leadership positions too. I mean, you were a liaison to a commission, but students and residents can also, become, a member of these commissions. It's not through an election process, but an application process. So it's always impressive how the Academy makes so many leadership opportunities for residents and students. I guess it really emphasizes how much they value the opinion of residents and students.
Oh, absolutely. And I will say, that starts from the state level as well. So, getting involved with it within the OAFP, that's how I first even started to get involved in the AAFP, honestly. And if you don't know where to go or what to do, I will say, come to the OAFP and they will help guide you, because I would not known what to do if Ann Spicer, she kind of held my hand, between her and Dr. Sam's. They helped show me the different routes, because the AAFP leadership and academy is just so vast. There's so much to know and to try to wrap your head around that you need somebody to kind of show you the ropes, in my opinion. So if that's a fellow resident, a fellow student, just reach out and ask them. If you're interested in any of the positions, I think you should reach out and talk to somebody. They can help point you in the right direction so that you can get a sense of what it's like. And I think one of the most important things when you talk to folks too is, what is this like, not only as a leader, but as a learner who is a leader. So, our time is a lot different as students and residents than maybe an attending physician. I don't know, I'm about to find out. I'll let you know. We have such limited time. So, talk to somebody who's in your shoes to really be able to get a good idea of that.
Yeah, I know from my standpoint, it went all the way back to, the medical student level or the FMIG level. And, I still have great mentors and great faculty leaders at that level. And then some of my peers from that point. And then you just get to meet more and more cool people as you go along. And you never know who you're going to meet. So the enthusiasm, it's really hard to kind of explain to somebody who hasn't been through it, but it's just like you said, Kelly, it's just asking questions, being interested. Any question, is an okay question to try to learn more about this. Let's see what else are we going to talk about. And just to let people know, Dr. Wood did put a link in the Facebook chat to the new AFP policy protects medical learners during the pandemic. So we'll be able to make that available for people as well. So,
Thanks,
and it's right there. So, Dr. Wood's our fans. We certainly appreciate her checking us out here. So, and I have to tell you, Kelly, one of my first Congress of Delegates meetings, the big meeting, I got to meet Dr. Wood where I didn't know anything. I was just like, hi. I don't know anything. And Julia was like, okay, this is this, and this is like this. And I'm like, okay, cool. Great.
Like,
I'm like, yes. I'm like, I'll ask you tomorrow because I won't remember anything you said. But yeah, so has been a friend for a long time. So she is awesome.
I will say when you get to meet some of the folks who are leaders like Dr. Wood, I remember the first time that I met her, I was so intimidated. I was like, this woman's incredible. What do we say to her?
Did I scare you about it? I probably scared you about her. Like, don't talk to Dr. Wood. She is so mean. I'm so in trouble after the show. This is so inside jokes baseball. So let's see here. So yeah, I guess before we wrap up, I think you mentioned at the beginning of this show when I was having technical difficulties. You're in Florida now. So what's your next step in your education, and what are you going to be doing next?
Yes. So I will be practicing in an outpatient office here in Bradenton, Florida. And I'll be doing everything from, taking care of newborns up through geriatrics. I'll still be able to do home calls, which is really cool. A lot of procedures. I think there will be an opportunity for me to work with residents still. I've actually been working with and I've talked to the office already about hopefully getting some med students in so we can continue that family medicine pipeline, which is really important. So we'll be reaching out to some FMIGs here in Florida to get in touch with them as well.
Are you a part of a medical system, or what's your practice situation then? Are you like an independent office, or how's that work?
No, it's an employed position, so it's through a medical system.
Okay, well that's cool.
Yeah.
That's cool.
Yeah.
And so do you have some time off? Are you gonna jump in tomorrow? Like when does all this start?
No, so I'm just here looking for a house, a place to live right now, and I'll be flying back to Ohio in a few days, and then I'll start in October. Actually, I do have some other training that I'm going to be doing here in September over in Orlando for comprehensive reproductive health care, including abortion services. So I'll be doing some of that type of stuff, and then still trying to keep up to date with my family medicine journals because I don't know how attendings do it, how you stay on top of everything. So I'm gonna try
I don't.
Anybody who knows, if you can give me the information, that'd be great. I'm going to try to hopefully develop something where I'm just, constantly reading and trying to get the information that's new. I've heard the prescriber's letter is really great, so...
Yeah, there are so many great resources. It's just selecting which one is of your highest priority and your highest interest. I put all my stuff on my phone because who uses paper anymore? Like, come on, people. So you use paper. I'm sorry. I just totally offended you. I'm sorry about that.
The internet stopped working on my phone today, so if you can help
me. No. Wow. Let's see. So you just took boards. So Is that right? So you survived. You kind of survived. Like, what was your process? I'm just kind of curious because I re-upped, I think, last year or the year before, and I took like the whole AAFP board review course. Not that I'm endorsing it or whatever, but I mean, I think it's a good course. What was your prep? What was your prep for boards?
I also did the AAFP review course. It's something that our entire program does, actually. So all 13, we had 13 in my class. All of the third-year residents do the AAFP prep course together. And so we actually went to Indiana and we did the last review course. And so I kept that material, which was really great. I got to go back through it. And then during COVID, the AAFP reopened up the board review course online for free for learners because a lot of our curriculum had changed. And so that was really a great opportunity to go back and rehear some of the lectures and kind of delve back in. But really, so I did that. Really the biggest thing was reviewing my old ITEs and then just doing the AAFP questions that are online underneath board review. I don't know if you recall that, but it's like 10 questions at a time. And then it goes through and links it to the AAFP article that it comes from, which was just really helpful. So I just did questions and questions and questions.
So our time is quickly coming to an end here. So it's in a little bit. I'm going to have Caitlin come up with a kind of a closing slide, but I'm going to give you the last word there, Dr. Kelly Thibert. I want you to maybe share some closing thoughts specifically about family medicine leadership and national conference and that meeting coming up, and why you think it's important for residents and students to really be proactive and to seek out leadership positions and to really try to make it and change the world.
Thank you. So I will say I really hope that I see you all at this upcoming national conference. Even though it's not in person, there's going to be so much great material and programming for us to experience, and also still being involved in decision making with policy and leadership elections. Definitely stay involved. I know it's hard when it's virtual, but it's so important, especially now. This is a time when nobody knows how anything is really affecting people because nobody's ever lived through this before. So, if there's something that we should be talking about or addressing or doing differently, or, pivoting to do, it's really important that we as students and residents use our voices to say those things, whether it's about systemic racism, whether it's about response to COVID-19. This is the time, and not that it wasn't before, but now it's imperative that we use our voices and step up to do so. Your voices will be heard, and it's important that we do use them. And also I want to encourage you to run for a leadership position. I told you I was scared before everyone I ran for. Mike clearly was scared and thought he wasn't even going to get the position. But you deserve to be here. You've been working so hard. And if this is your first leadership position, that's great. We're here to support you. And I can't wait to welcome you to the national conference coming up here at the end of this month. And I hope to welcome you to the AAFP leadership coming up here soon too. If you have any questions, you can always reach out to me. I'd love to talk to you some more about the AAFP and about leadership positions and opportunities. So just let me know. But go out there. You're changing the world, everybody. Family medicine is where it's at. And, that couldn't be more obvious during a pandemic. Family medicine is the specialty.
Cool. So as we close things up, let me bring in our director of Foundation and Strategic Programs, Caitlin, kind of on the stream here. And hi, Caitlin.
Hi.
Do you have like some stuff to share with us, like a slide or some merch or something like that?
Yeah. So the thank you slide here with our final resources that we like to share with you all. A reminder for the AAFP National Conference, you can still register for that. We've heard a lot about that this evening. We do have a resource on applying to the new ABFM COVID-19 self-directed pathway. It takes about 10 minutes, but we've created a step-by-step instruction video for you to walk you through. We also have a COVID-19 webpage that we keep updated with anything that's coming out. The Joy Among Chaos webpage. There are webinars there for free, all on wellness, articles, resources. Definitely check that out. And then, of course, our bite-sized learning webpage. We will house all of our recorded sessions there and then promote any upcoming sessions. And if you have a session or would like to hop on here with Dr. Sevilla and share a story, please do so. Let me know.
Cool. Yay! Do you have like a merch slide that you can share, like a screen share of?
Show us the masks.
We have merch, or merchandise, as they say in the biz, here at the OAFP, and so we have shirts, doctor's order shirts. So the OAFP has joined other Ohio organizations in having people say, hey, wear a mask, people, and stand 6 feet away. But hey, I ordered, like, the masks come in light and dark. I ordered both. I don't know if I ordered a shirt. I probably should. And then we have our conference shirts for OAFP. I ordered my family medicine conference shirt, so that's going to be cool. So all the proceeds go to the OAFP Foundation and our programs. And oh, Kelly, you have your shirt here, so we'll get you on the big screen here. And I forgot mine because I'm a slacker. But yeah, all those proceeds go to the foundation, right, Caitlin?
Yep, a small portion will go directly to our programs, and we were able to do our summer preceptorship program even through COVID. We had a lot of experiences still happening in practice, and if they weren't able to do that, we offered a virtual experience. So we'll still have about 58 students that we're supporting this summer who are all here. So
That's really incredible.
impressionable age that we want to have them hear about family medicine first, and we're able to do that this summer. So thank you all for your purchases and donations throughout all of this. We appreciate it.
So cool. I think that's it. I want to apologize for my technical difficulties. I'll try and get it all fixed before next week's show. Next week, very excited. Our good friend Dr. Renee Critchlow from Minnesota will be joining me, and we'll be having a great conversation about a lot of stuff. She has a lot of great stories to share, and she's an awesome advocate for a number of family medicine things. So join us next week, July 19th at 8 p.m. Eastern time. So that's going to be a fun time. So anything else? I think that's it. I think we're going to get kicked off of here. So
Thank you.
all right. Good night, everybody.